Good evening, everybody. You're very welcome. We'll just let everyone join. Right. Okay. I think people have stopped coming in. There may be people who join us. So good evening, everybody. A very warm welcome to our caring conversation. I'm Dr. Lara Alloway. I'm a consultant in palliative medicine and I'm the Chief Medical Officer for Hampshire Hospitals. So I'm going to start off with a bit of housekeeping, which I always forget to do. So I'm very pleased I've remembered. So we have turned on the live transcription and we are recording tonight. If you could make sure that you're muted so that we don't get any background noise, which might put people off, we'd be very grateful. There will be some opportunity for questions and please feel free to use the chat function, which will be on. If you don't want to be identified, please turn your camera off, but if you're happy that we can see you, that's always nice to see faces rather than just black, so that would be great. And I'm delighted tonight to be proud to introduce the Hospice Services of North and Mid Hampshire and my amazing colleagues who work as part of those. For me, these services are really close to my heart and actually slightly map out my consultant career. I joined St Michael's and Basingstoke Hospital back in 2005, and since then I've seen the services the hospice provides develop dramatically, particularly in recent times. I worked to develop the North Hampshire Palliative Care Service. And in 2012, when we became Hampshire Hospitals, I met Maddie Thompson, who you can see on your screens, and went down to work in Winchester. And that's when I was recruited to understand that there really was a gap in provision of hospice services around Winchester. And joined the dream of wanting a new hospice. And as you'll hear, we were delighted to open Winchester Hospice in 2021. And then at that time, I also met Sarah McGockey, who's the matron of Countess of Brecknock Hospice, and was proud to be the consultant there for many years. And we, sounds like all I do is build hospices, but all I want to do, we actually went through some renovation back in 2013. At that point, had a real desire to develop Countess of Brecknock and the new building, as well as all the services, and really amazing building opened in 2020, supported by the trustees of the Countess of Brecknock. So you will hear all about these services as we go on. But why are we doing this caring conversation this evening? This week is Hospice Care Week, and the focus for the week is opening up end-of-life care to all. And we'll talk to you about how we're doing this locally. To quote the founder of modern hospice care, Dame Cicely Saunders, "You matter because you are, and you matter to the end of your life." And our hospices provide care for patients and their loved ones who have incurable illness. And I think it's important to make the point that for some people, that care may just be for a few days. But for others, they may benefit from hospice services for many years, usually on and off during that time. And although I seem to have focused on buildings, our hospices are buildings, but they're actually far more than that. They're a hub for many services, as you will hear, most of which provide the majority of the care off-site, away from the actual building. And of course, a building doesn't provide care itself, but it's the fabulous staff that work within the services that do this. And in this locality, our desire is to absolutely provide the highest quality care for people. So people who are at the end of their lives die well, but making sure they live as well as possible until they die. And we know that working as a multidisciplinary team with a patient-centered approach is the best way to do that. And you'll hear from everyone, all my colleagues this evening, about the things we do to enable that. But it's important to say that the hospices don't just impact the patients who they directly care for, but we provide education, we raise awareness in the local population. There's a lot of training and support to other health and care staff. And our sort of public health approach to make sure that we're encouraging people to think about the plans that they would want or their family members would want about at the end of life, and that we know that we can improve the quality of the care people receive if they have some of these conversations earlier on. The other slight difference for our hospices that you'll hear about is all of them are on hospital sites. And we think that this not only helps and benefits the patients who are receiving care in the hospices, but there is a mutual benefit. And I know that the hospitals, the hospital staff and the hospital patients also have that benefit. And that sometimes is through education, but it's also a culture of care where we believe that some of the things you'll hear about this evening, the quality of care and some of the smaller things are incredibly important in somebody's care experience. And most importantly, what I hope will come across tonight is the benefit of the collaborative approach we are taking together, so that actually our local population benefits from all of the brilliant people you'll hear from wherever they live. So that's my introduction to this evening. And without further ado, I will hand you over to Maddie Thompson. Thank you, Maddie.
Good evening, everyone. As Lara said, my name is Maddie Thompson and I'm a consultant nurse in palliative care. And I'm the clinical lead for end-of-life care in 4 Hampshire hospitals. But probably most importantly, I'm an absolute passionate advocate for equity of services of care, so that everybody that crosses the pathway, if we like, of Hampshire hospitals should receive the same standard of outstanding care in our communities in and around Basingstoke, around Andover, and of course around Winchester. And I've been in this particular role for the last 6 months. It's been a real joy to be able to visit other sites and do provide education, which is the other subject that I'm particularly passionate about, and infuse nurses to become nurses, because of course we're struggling massively at the moment with recruiting nurses, as you will have heard on the radio. And it's our job as trained nurses to inspire those who are thinking about a profession in healthcare. Rather than talking about all the issues and all the things that we don't like, our role is to inspire people about all that is wonderful about the NHS. So I'm now going to tell you a few of those things. And I'm going to focus particularly on collaboration. So I hope you can all see these slides. So I'm going to start at the top left and talk about collaboration in the voluntary sector. So some of you will be aware earlier on this year about the Health and Social Care Bill. And one of the things about it is it really focuses on commissioning, so buying services in that are collaborative. So we're working with voluntary sectors because I think we're recognising that as the NHS, we can't do it all by ourselves. We rely very heavily on informal carers, for example, and other voluntary agencies. So it's really important that as the 3 hospices that we work closely with some of these. So to give one particular example, in Winchester, we're working closely with the Winchester Bereavement Service to help us run bereavement evenings in Winchester Hospice. I know they're doing something very similar in Andover and also at St Michael's. We, across the board, are linking with financial charities to support people that can't afford some of the things they need. Perhaps they're on a 0 hours contract and can't afford to have chemotherapy because they can't afford to pay their bills if they don't work. So we can then access financial support for those people and their families. So that links onto volunteering. So some of these people, of course, in the voluntary sectors we're working with are in themselves, they're volunteers. And volunteering is an essential part of our service. Now, not just for fundraising, of course, but also to provide and support the work that we're doing. And if you're interested in volunteering, this is a fantastic opportunity because there are so many different areas, whether you would want to be patient facing, whether you want to sit and answer the telephone or be a working reception or welcome people to our hospices. It's a vital part. And I think also it serves a need to our local population because actually we'll all be aware of some of the issues facing people, particularly the older generations, of loneliness, of perhaps a lack of self-esteem, maybe people are out of work. And for them to, I think volunteering offers a service to them, to support them as much as it supports us. So again, an area that we welcome interest in for St Michael's Hospice in Basingstoke, Countess of Brecknock Hospice in Andover and Winchester Hospice. We have many, many volunteers. I think probably each hospice has in excess of 60 volunteers. I'm sure you'll hear from each of the hospices and they'll clarify that. But please do get in touch to your local hospice if you're interested in volunteering. So another way in which we collaborate is looking at staff's well-being and providing opportunities for staff in Hampshire hospitals. So there are many ways in which we do this, but one particular area is in education. So in order to provide inextricable links to outstanding practice, we have to educate our nurses and doctors and healthcare professionals. And we can do this in a variety of ways, but I think one of the challenges is for nurses to leave practice to attend education. So rather than a more creative way, it might be rather to swap a nurse from the hospice to go and work in the acute sector, and for a nurse in the acute sector to come and work in the hospice for a week. So giving them both very, very good, valuable experiences, but not losing that nurse in practice, which I think is essential at the moment, particularly as we are coping with reduced numbers and with sickness and all sorts of other reasons. So the other opportunities for staff are also just development in terms of exploring what they want to do. So in our hospices, we provide expert care, but it's not for everyone. And actually, I think you'll hear from Megan later on, who is a newly qualified nurse. And actually, I think there's a perception that you can only work in a hospice if you've got a particular level of experience. And her experience will demonstrate that we are key to supporting all of our staff, no matter what their background is or where they've come from. And of course, we have lots of international nurses working with us as well. So the education that we're moving around to on the right here, and I talked about that linking to outstanding nursing practice. So as palliative care teams across the board, we educate. We educate face-to-face, we educate in all our conversations, and we also put on formal study days with St Michael's, Countess of Brecknock and Winchester Hospice collaborating. But I think there's one tomorrow, in fact, which Countess of Brecknock are hosting, but hospice staff from each of the other sites are attending. And that's just one of the examples of collaboration. And of course, in order to have healthy, well staff who love their work, they need to be able to access support in the ways of clinical supervision. And sometimes when you're talking about a difficult case or something that's particularly challenging, it can be hard to talk to somebody who you know well. So of course that enables, so for example, I could go to St Michael's and listen to the staff there, and somebody from St Michael's might go to Andover, and someone from Andover could come to Winchester Hospice. Another great way of facilitating clinical supervision, as we call it, and supporting our staff to provide the best they can really, and helping them reflect on the particularly difficult and challenging cases that we see day to day in a working hospice. So that takes us on to staffing and utilising each other's talent. So it won't surprise you that we're not all good at everything. And actually we have to recognise the strengths of different members of the team and also the aspiring strengths. So somebody who is keen to become, for example, a clinical nurse specialist. So our clinical nurse specialists go out into the community from St Michael's and also Countess of Brecknock and Winchester Hospice and provide expert support for patients who have chosen to remain at home, and also patients who are able to remain at home because they are in the early stages of their palliative care support and are trying to get on with their lives with that support. And actually there is a training pathway to becoming a clinical nurse specialist, and I've recently become a lecturer at Winchester University, and it's been fascinating looking at education and seeing how early we can start supporting nurses to make decisions about their future, which, you know, it can start early on if they're really passionate about a particular area, such as palliative and end-of-life care. So as a nurse and as a healthcare professional, none of us can really talk about our work without thinking about our duty of care. And our duty of care is not only wrapped up in our becoming a healthcare professional, but also the feeling that we want to support our local communities. So fundraising for Winchester Hospice was a huge sense of that this is what we need in Winchester, and in Andover increasing the beds, and St Michael's, the amount of fundraising that's going on is because we really care and we want to get it right. And these hospices are at the centre of our communities. I'm just going to go on to this next slide to give you a few examples, and just in terms of things that happen between us all the time. So down the bottom in the middle here, we collaborate with the University of Winchester, the Global Health Hub. So about 2 months ago, I went with Stephanie Roster, who's our operational manager, and Kofi Porty, who himself is from Ghana. And we visited Ghana for a couple of weeks, explored the world of palliative care in Ghana and how they are aspiring to provide it in more areas than the one hospital that currently provides it. Now, this collaboration with Winchester University and Hampshire Hospitals is going to enable a wealth of education. So there are Ghanaian nurses working throughout Hampshire Hospitals in all the hospices, and this will enable us to understand the culture that they're working in and to really support them as they develop in their palliative care career. And we're happy to welcome also a doctor from Ghana who's going to be spending an elective with us in the new year. And that's everything from me.
Thank you, Maddie. That's brilliant. So we've whet your appetite, I hope, and we're going to move on now to think about the progress, the achievements, and what's coming in each of the hospices. So perhaps I could invite Donna to start.
Thank you. Wow, what an amazing start. Only to follow Maddie, and for Maddie and for many of you, the journey started so long ago. For me in palliative care, the journey started when we opened a year ago. Having watched it, they've turned a dream into reality, and here we are 1 year later, having welcomed and cared for over 300 patients, which is just phenomenal. On average now, we're caring and supporting between 30 to 35 patients every month, taking referrals directly from GPs, communities, and directly from the main hospital site. Additional to this, we've successfully introduced our community palliative care team services, and we also continue to provide home care, which has supported and facilitated a number of discharges, with our average length of stay being between 1 to 2 weeks, and then supporting patients to return home to the environments around their loved ones for their preferred place of care. For ourselves in our start, our main focus was building a really strong foundation to ensure future growth development of our services. Our team now includes a fantastic team of physicians, nurses, healthcare support workers, OTs, home carers, community teams, chaplaincy, volunteers, complementary therapists, biographers, administrative teams, and that's just to name a few. We have been so privileged to welcome new staff from a variety of backgrounds and experiences, just like Maddie was saying. But this hasn't enabled us just to provide high quality of care, but have really enabled us to provide extended nursing care. Maddie's already mentioned about education, but education and staff development remains our priority. But it's not just for the team at Winchester Hospice, it's for the whole of Hampshire Hospitals and our local community. As a team, we've already hosted 2 very successful study days, which has been based on our own identified learning needs, our experiences and feedback. And in fact, we were really pleased to welcome some of our local community staff attend our last study day in September. We have staff at Winchester Hospital on a variety of developmental pathways, including healthcare support worker apprentices. In fact, recently I've been working alongside the clinical apprenticeship lead, influencing their diploma curriculum and introducing palliative care modules into what we really would generally be an optional unit to choose, but looking at making it mandatory for all healthcare support workers at Hampshire hospitals, because end-of-life care and palliative care, symptom control is everyone's business. We've also got a fantastic group of preceptorship nurses, and like Maddie said, you'll be hearing from one of those later today, Megan. Training, we've already delivered children's bereavement courses, advanced communications training, leadership courses, and we have a number of staff on postgraduate training courses, such as history taking and assessment, and the nurse prescribing courses, enabling our team to prescribe medications at the point of need. To further support training in the trust, we are in the process of developing training modules which will be accessible for all staff across Hampshire hospitals, which they can access via our learning platform, Green Brain, for palliative care and symptom control management. As we start our journey, we've identified quality improvements, and we continue to share ideas to enable us to grow and further support the team, further support our patients and grow our services. Some of our new services have been the introduction of our Bereavement Services and Allium Cafe, introducing our biographer, which is great to see joining us today, capturing stories for life for patients to enable them to share with their loved ones. Our complementary therapists will soon be starting. We have a Go Green project, and our OT has actually been using specialist sheets to support repositioning of patients, which is a new initiative within an inpatient setting, which is traditionally just provided in the communities. Maddie's mentioned charity funds, which remain very important focus. And our team here at Hampshire Hospitals have been supporting those events. In fact, we had a really fantastic, successful craft fair only last weekend. I am so pleased to be sharing our stories today. And this week we'll be taking time to celebrate our successes as we reach that 1 year of opening. This week we'll be celebrating, sharing our stories on the radio, hosting events, and this week we've got our Go Purple, so I hope to see lots of you in purple, celebrating that 1 year, just sharing our stories and about how you can continue to support our service. For me, the journey has just begun. Very much looking forward about working with our complex discharge teams to further raise our profiles within the community, increasing the care we can provide out into people's homes, expanding our community palliative care nurse services, further networking with local communities, and further providing training and development to our workforce. I've added a few photos myself, and I hope this captures it all. And I was so excited then when I was looking back through some of the photos about our journey over the last year. Beautiful garden there. I mean, look at it. It looks absolutely fantastic. And only today I was out in the garden with patients, with relatives, and I can't begin to tell you the therapy that brings to everyone, including myself. Fantastic there. We can see Lara with one of our international nurses who actually won an award for her care. Lots of pictures with animals there. Actually, I think the staff, but the patients in particular, and that picture at the bottom there, introducing pet therapy. I can't begin to tell you the joy and comfort that brought to that patient there. And fantastic to see our two overseas nurses there from Ghana, and I know Maddie shared that story earlier. Our team study day. This is a picture of us doing colour training as a team, and that was about us coming together, learning more about each other as we took our steps forward. Introduction of our new healthcare apprentices, our domestic team. Together we are really forming a really strong foundation to move forward. Thank you.
Thank you, Donna. It's lovely to see the photos and to think that just over a year ago, this was still really a dream. We built the building, but you have established an amazing team. So thank you for everyone's hard work. So now we're whizzing up the M3 to St Michael's and hand over to Gemma.
Hello, everybody, and good evening. I'm Gemma Storer. I'm a consultant in palliative medicine working in Basingstoke, and I'm also the medical director at St Michael's Hospice. I've been a consultant for the last 5 years and taken over as medical director for the last 2 years. So now I'm going to attempt to share my screen. So just bear with me. Can you see that? Okay, that's a good start. Okay, so I'm just going to talk a little bit about the services that we run out of Basingstoke. And the first thing to start with is that we are slightly different to Winchester Hospice and Andover Hospice, because we are an independent organisation and a local charity. And while we get a little bit of NHS funding, the rest of it comes through charity and income generation. But even though we are not, oh, let's just move on a bit quicker. Sorry. Even though we are not NHS, we work incredibly closely with the NHS, and we are an independent organisation, but we actually really consider ourselves to be one team along with Winchester and Andover. And I will talk a little bit of some examples of where that comes into play. But this is very much our philosophy. Our hospice care is actually about trying to maintain life and it being a time to live. It's about maximising an individual's quality of life. I'm often saying to patients, why I have no bearing on the quantity of life, our goal as a team is to improve your quality of life for as long as possible. And that's what we aim to do out of the services that we run. So this is the area that we cover up in Basingstoke. We, you can see on the map there, we support a population of about 250,000 patients. And we have about 110 paid staff, but we are supported by over 600 volunteers. And that is across our retail and our fundraising, as well as in our clinical areas. So let me talk a little bit more about what actually goes on in the patient services. So we have an inpatient unit, we have a hospice at home service, we have a therapy team, we have a patient and family support service, and our latest addition is our living well service. So the inpatient unit. In Basingstoke, we have 10 beds. They are all single rooms, and we have people come to us for a whole variety of reasons. It is often because of symptom control, so that our patients who need specialist input for care in terms of perhaps pain control or nausea or vomiting, but it doesn't have to be physical symptoms. The psychological support is just as important to us as the physical. And often these things are not single in their nature and they overlap significantly. One of the things we do is complex discharge planning, and patients often come to us from the local hospitals who need a complex package of care to get them home, because actually one of the myths about hospice care is that it is only care in dying, and that's only a part of what we do. And actually in the last year, over a third of our patients went home and didn't end in an end-of-life admission. But care in dying is very much part and parcel of what we do as well. In the last year, we were able to care for 214 different patient admissions. And the average length of stay on the inpatient unit is about 11 days. I think that's one thing that is really challenging in hospice care is that we are not long stay units, and we wish we had the ability to look after people for ever and a day, but by nature of the service, we have to try and achieve the best care for as many people as possible at any one time. And inpatient care is actually only a very small proportion of what we do. Exactly like Lara indicated, the building is only a very small part. And that's some figures I've already mentioned. One of the biggest things that we do is looking after patients at home, and we run a hospice at home team from the hospice, and this is quite different to other hospice at home teams around the country. We are a sort of rapid response nursing team that goes into patients in their last weeks of life. They're specialist nurses who work alongside doctors and other therapy team, and we give patients symptom control advice. We are able to administer medications in the home, but we are not a domiciliary care service, and that is different to some of the services that are offered elsewhere. We do also support people in care homes as well via this team. And this team is operational 7 days a week from 8 AM until 8 PM at the moment. We have a whole variety of staff working in the hospice, just like Donna mentioned, that have the very long list, and I completely echo that in our area as well. But one of the most instrumental teams are the therapy team. We have occupational therapists and physiotherapy staff working with us, and they work in the community seeing patients at home as an outpatient and very much on the inpatient unit, because trying to maintain people's function ability is really important. And that is all about trying to keep people where they want to be. So they are absolutely instrumental in that. And the other part of the therapy team's role is very significantly involved in our motor neurone disease service. So hospice care isn't just for patients with cancer, which is again one of the common myths. We do a lot of work for non-malignant disease, and we would like to increase that reach all the time. But one of our very well-established services that we're very proud of in North Hampshire is the support we are able to offer to our motor neurone disease patients. And the therapy team are absolutely instrumental in that service. And then we have our patient and family support team. They are the team who are made up of the chaplains, the complementary therapists, our bereavement team of counsellors and listeners, and they are the team that do all of the other stuff that help us support not just the patient but the family as well, which is really important. And this is while the patients are alive, but also in the bereavement process as well. And again, they are absolutely instrumental, and they work on our inpatient unit, in outpatients again, and reaching into the people's homes. So, oh, sorry. What I wanted to tell you a little bit more about, though, is what's to come. So that's what we do right now, and the goals is always to try and do more and more, and how can we better support our population, and how can we further our reach. And the things that are currently on our agenda at the moment is opening our Living Well service, as I mentioned, and that has been delayed because of COVID, but it is due to fully launch in November, where we will be looking to offer tailored program for patients, which will include things from crafting, from Pilates, more complementary therapy. We'll be offering financial support and advice to patients and families, and these are just a handful of things that are to come. And I think Maddie mentioned it, and it's very true, and particularly in this service, it's all about collaboration with the other services that are out there and other charity organisations, because we want to be a hub for all of that activity, and to bring people together so that we can maximise the support that we can give to our local population. One of the other things I wanted to go back to is about the collaborative work between the 3 hospices. We are always looking to work together where we can and try and learn from each other, but also recognising that we also, even though we are pretty close in geography, there are nuances to our populations as well. And what is important to a patient who lives in Stockbridge is going to be very different to somebody who lives in the centre of Basingstoke. So while we learn together, we also then try to tailor it for our local population as well. And one of the things I'd like take-home messages is that we are always looking for feedback and to learn and to better ourselves. So the only way we can do that is with local engagement with our population. So please do get in touch. Please send feedback, stories. That is the only way we can improve and get better. I'm going to leave it there because I think some of it probably will come out in the questions, because I could talk for a whole hour just myself and I don't want to take Sarah's go. So I look forward to answering some questions later. Thank you.
Brilliant. Thank you, Gemma. And I have to say, I'm filled with pride when I hear Gemma talk, because I remember when Gemma wasn't a consultant and we were delighted to encourage her to come and work with us, and that clearly she's showing exactly why we wanted her. So thank you. This really is a conversation, so we're really keen, while you listen to Sarah, to just think about anything you want to discuss, you want to ask or say, because actually we are, as Gemma says, really keen to have your feedback about what's important, what you think as hospices in your local area we might do differently or do more of. So really to open up the conversation. But let's go across west, I think, I hope I've got my geography right, to Andover now, to the Countess of Brecknock team. I think we're starting with Sarah McGocky. Hi.
Yeah, hi everybody. It's lovely to be able to have the opportunity to speak to you all. My name is Sarah McGocky and I'm the clinical matron at the Countess of Brecknock Hospice. And the only trouble with going third in the line is that everybody has said everything already. So I'm not going to list all of our services for you, but just that we have many, many services here, and we are really proud to offer all the care that we do and collaborate with the other 2 hospices in our area. And although many of our services are similar, including our inpatient, community and daycare facilities, there are differences within each hospice. However, we all share our skills and experiences, with the aim to constantly improve and design our care around the patients, and that's fundamental to the care that we deliver. Here in Andover, we're incredibly fortunate to have moved into a new purpose-built hospice in the spring of 2020, which was only due to the very generous support from our charity and our local community. And I'd just like to introduce you to my colleague and friend, Michelle Gard, who's our charity director. Careful, you might get
Thank you, Sarah. Good evening, and I'm delighted to be part of this Zoom this evening. For more than 30 years, the charity, the hospice and the health authority, now HHFT, have enjoyed a really special and unique working relationship, which has enabled us to develop the hospice services based here at the War Memorial Hospital. As well as financially supporting running costs, the charity raised £4.8 million from our local communities of Andover, Stockbridge, Sutton Scotney and the surrounding villages to build and equip Brecknock House, the new hospice facility, which was gifted to HHFT in 2020. As well as supporting the running costs and equipment, the charity also invests in patient and staff welfare. And I'm just going to share the screen because I've got some lovely smiley faces. So the trustees are very conscious that the clinical team are COB's greatest asset and support training for staff, team days, one-to-one clinical psychological support, and also regular fruit boxes and a soup bar, because they're really conscious that the staff never stop. And when they do, they want a tasty and a healthy snack available for them. So our trustees provide that. The charity trustees are also hugely supportive of the clinical team and are great advocates of the hospice. And I know that Sarah won't mention this, but the trustees were delighted to hear that the team recently achieved gold status in the latest HHFT ward accreditation. And they can share that wonderful achievement with others and discuss and share with others how they've got to that award status. And such an achievement in challenging times is a true testament to the calibre of staff and their commitment and dedication here at CROB. And I also feel very proud and privileged to be part of that team, and also to be able to share with them the successes of not only the charity, but also their successes and the successes with our patients.
Seamless, isn't it? Yeah. Thank you. I wasn't going to mention that, so thank you, Michelle. As mentioned before, our services at the Countess of Brecknock have evolved around the needs and requirements of our patients, who are all central to all that we do. We care for patients in both the community and in the inpatient unit. We have a community palliative care team, which I won't talk to you about. Lorna will talk to you about that a little bit later. Our home care team care for patients in their own homes, which, as you've heard, prevents unnecessary admissions to acute hospitals, as well as facilitating speedy discharges, or at times just bridges the gap from when a patient wants to be discharged from hospital and their package of care can start. Our daycare is absolutely fundamental in maintaining people's well-being while people remain at home. It provides social medical care for those that attend, as well as providing a psychosocial and peer support, as well as friendship and, frankly, just lots of laughter. As Michelle explained, we have an amazing 10-bedded inpatient unit. However fabulous the building and the environment is, our main focus remains our patients. And along with all the usual medical and nursing questions and procedures and processes, we always ask the patient one question, and that is, what is the most important thing to you? And I think if you ask that question, you have to be prepared to listen to the answer. These answers can sometimes and often be quite poignant, and they can also offer a challenge to the team. It is this individuality and attention to detail, as well as thinking outside of the box, that makes palliative and hospice care so special and so individual. And if it's okay with you, I'd just like to share a few of our recent important patient stories for you. My assistant will share the screen. I won't be able to. Wrong screen.
I know, we'll move it on.
We'll move it on one.
There we go.
Oh, there we are. Can everybody see that? So I'd like to share a few with you. So first off, the big picture in the middle with the two elderly couple holding hands. This is a picture of the hands of both John and his wife, Violet. They were among the first patients that were admitted to the hospice. John was transferred to Andover, not funny enough in the hospice on Kingfisher Ward at Andover War Memorial, but it soon became evident that he was requiring end-of-life care and he was referred to us in the hospice. When we asked, what's the most important thing to you, John, it soon became apparent that his wife, Violet, was also a patient, but she was a patient at Basingstoke Hospital. And as you've already heard, we opened in the spring of 2020, and COVID was big news back then. Visitors weren't allowed, and the most important thing both to John and Violet was the fact that not only were they both in hospitals, in different hospitals, but the fact that visitors weren't permitted as well in an acute hospital or on Kingfisher Ward. So a little bit of common sense and literally a few telephone calls, we managed to bring John down to the hospice here in Andover, and while arranging for a transfer of his wife from Basingstoke here in Andover to the hospice. The most fascinating and a fabulous thing was that some of our rooms are actually quite big, and they could accommodate 2 beds in the one room because they rarely spent time apart. This was very touching and very special to both John and his wife Violet, and also their families as well. I have to tell you, although John was keen to share the room, Violet was less keen at night and asked if she could be moved out into the room next door. So although they shared the days together, at Violet's request, she slept on her own. Sadly, John did then go on to die here in hospice, but I'm really pleased to say that we managed to discharge Violet home, and she lived for about another 5 or 6 months at home with her family. So that was a good story. I don't know which one to pick up next for you. Let's start at the top there with Sue. She is an avid line dancer. She was also a patient during COVID. When we asked what's important to you, we found that she missed her friends as well as the companionship and enjoyment that line dancing brought her. Again, you can see it's the springtime. So we held frequent line dancing sessions in the garden, a really simple, easy thing to do. As a team, we soon realised that line dancing was far more complicated than it looked. That actually it was a simple thing, but that was important to her. So that was great. Staying on the garden theme at the top there, Les loved his garden. He was a real outdoor country man. When we asked him what he liked doing, his hobbies were his allotment. He used to make walking sticks and bird houses. Unfortunately, he'd spent quite a few weeks in an acute hospital, and if you look, he's got a few bruises on his face there. And he hadn't ventured outdoors for over 4 weeks. You can imagine the absolute delight and the sense of well-being when he realised that he had access to a beautiful garden directly from his room. And I think the lesson that we all learnt there, that the best medicine sometimes is just simply being outdoors with some fresh air. And the picture to the side here with the wedding dress, this was Trevor, a middle-aged man, sadly only with a few weeks to live. He was not going to be able to give his daughter away at her upcoming wedding. And knowing this was the most important thing to both Trevor and his daughter, as this is a very special task that the father can do for the daughter. We spoke, and what we arranged was a giving away ceremony, which, if I'm honest with you, we just made it up. It was a ceremony in which Trevor and the new husband and his daughter came in during COVID, and we arranged a giving away ceremony, which was very touching. The real ceremony actually took place about 3 or 4 months later, which of course Trevor was unable to attend, but they both actually managed to have that very special moment together. And then let's go on to a fun one. Father Christmas, down here in the bottom corner. He was invited to the hospice last Christmas, and this was following a particular sensitive middle of the night conversation with Sarah, who was a mother of 3 young children. And despite all the chaos and difficult things that were going on in her life, the most important thing to her was the fact that she wouldn't be able to take her children to see Father Christmas on the special watercress train line, which had been planned and booked for the very next day. Now, bearing in mind this was about 2 o'clock in the early hours of Sunday morning, and the watercress line was booked for 3 o'clock Sunday afternoon, it was the ingenuity and the resourcefulness of the team that meant that all 3 children and Sarah spent time with Father Christmas that very Sunday afternoon. Now, when I chose this picture, what you can't see in that picture, I don't quite know how this happened. Father Christmas also brought a miniature donkey with him, but he's not in the picture, but he was there and added to the festive fun. So you've heard tonight all about the amazing facilities and services that we offer here at the hospice. I think you're going to stop sharing now, yeah. Oh, no, that's Lorna. So we're great at patient care, not so good at IT. So you've heard about all the amazing services and facilities that we all offer, but the one most important thing I'd like you to take away tonight is that patients are at the centre of absolutely everything that we do. And if it matters to the patient, it matters to us as a team, no matter where that patient is. And on that, I'd like to hand you back to Lara.
Thank you, Sarah and Michelle. And I have to say, Sarah, over the years, has pulled amazing things out. When I think I've disappeared off on Easter break saying, we need a wedding, we need this, we need that, she does it all. So absolutely amazing. And as you say, with the patient at the centre of everything. So we've got a bit of time now to open up to a conversation. And so if you want to raise your hand, which you can do, I'm sure everyone knows exactly how to use Zoom, but to go to the reactions and put your hand up, or if you just wave on the screen, somebody will try and spot you, or use the chat. And there's Zena, she knows how to raise her hand. Hi, Zena.
Hi, thank you, everybody. Yeah, Lara, absolute recognition of everybody's effort and great delivery of care and compassion. Just one thing that I'm struggling with as operations director in the division is I often find that the disappointment of families between, well, it's first of all how wonderful the hospice care is when they transition from the wards, but their absolute disappointment if they compare retrospectively what they've received on the wards and how it then transitioned to hospice care. And the ratios is different, environment's different. I know all those things. But collectively for us as a caring team, that's a big challenge because the end-of-life patients usually have days, weeks, if they're lucky, and maybe months, and sometimes hours. And Sarah and I've been looking at a complaint or a concern from Kingfisher, and with their intervention, the patient was transferred, received the best end-of-life care and died within 3 hours. So I suppose for us as a group, that's our collective challenge, how we move forward in improving that last end of life care for all of our patients, not when they hit the hospices.
Yeah, thank you, Zena. It's a really good point, isn't it? And they are very different environments. And I think, you know, the care that we can provide is very different. And there are many things in the hospice we can't provide that we can in the hospital. And it's making sure that we communicate that really well. But I completely agree. It's trying to make sure the care is of that quality everywhere, but people understand the different environments. Let me bring Maddie in.
I completely agree. And I know that, that you know that I agree. And I think one of the things that I think has been particularly important about having a hospice in the grounds of an acute hospital is the unbelievable opportunities for education. And it's very hard as a newly qualified nurse or a newly qualified doctor or a healthcare assistant who's hoping to become a doctor one day but is currently working as a healthcare assistant to begin to imagine what is possible in an acute bay on an admissions ward. And the only way to get people to imagine things is to actually give them examples and take them to something that is completely different. So to give an example of that, I love Thursdays at the moment. So Thursday is my absolute favourite day. Tomorrow's Thursday, so I'm in a very good mood because I get to go to Basingstoke and educate most of D floor. There are obviously takeaway, the wards are being staffed very adequately, but those that are not come to education. And it's absolutely great. And I've met nurses from Ghana, from India, from Nigeria. I've met so many different nurses with different backgrounds from all over the UK as well. And one of the things that is common is that they all have a very different perception of what good end-of-life care looks like. And for many of those international nurses, their idea of good end-of-life care doesn't involve a hospital or a hospice or a nursing home. It involves family caring for their loved ones at home. So to enable them to begin to imagine what we're talking about is actually quite challenging. But to give one example, I challenge them to go back to their respective wards and think about the layout of the bays. And actually there's no reason why in certain circumstances for a patient who is receiving end-of-life care in an acute hospital, they can't turn the bed around to face the window. Now, it might look a bit odd, but actually for that patient to suddenly have a view out the window that they previously didn't have is completely, it completely revolutionises their view. They're suddenly, rather than being reminded of what's wrong with them, i.e. the hospital, they're reminded of the trees and the view outside. And Basingstoke Hospital particularly is lovely and high up, it's got some fantastic views. So I think it's giving them permission to be creative, giving them permission to care in the way that we all care or would want anyone that we love or care for. But it's not easy, and it takes a lot of courage and it takes a lot of confidence. And some of our nurses, rely very heavily on their seniors to guide them. So the education is not just about those on the ground, but it's also about educating their seniors to give them permission to make courageous decisions about their care.
Brilliant. Thank you, Maddie. Any other questions or comments? So I'm going to ask one. Oh, sorry, Eileen.
Yeah. Hi there. So, hi, I'm from Cancer Services Partnership, as many of you know. How can we dispel the myths that go with the word hospice, palliative care? We all know, and we very much have heard this evening, that it's not just about dying. That, of course, is part of it, but there's so much fear. We hear it a lot from all our contacts. Don't mention hospice. I don't want to see any signs about a hospice. Take them down in any areas they go for treatment. So we, as Cancer Services Partnership, we very much like to do something to try and help dispel those myths. Any suggestions? What are your thoughts?
That's a brilliant way to open up a conversation. So I'm going to bring Sarah McGocky in, because actually in Cov, historically, they've done some different things to dispel that fear of the hospice. So over to you, Sarah.
You pick on me, Lara. Hi, Eileen. Nice to speak to you. So I think you're absolutely right. People sometimes have a fear of a hospice. Just the word, they think it's somewhere you go and you'll never come out again. And as you've heard earlier on this conversation, here in the hospice, over half of our patients are actually discharged. And that sometimes comes as a bit of a shock to people. And our hardest conversations with our patients are sometimes that actually, although you're dying, you're not dying just yet. So where do we go from here? So that does come as a bit of a shock sometimes. I think actually to dispel the myths, it's about, as Maddie alluded to, the hospice being part of the local community. And I know that all of our hospices are very much embedded into the local community. It's about us getting out and talking to various voluntary groups, community groups, whenever and wherever we might be invited to go and speak to them. We will most definitely be only too delighted to do that. But also it's about inviting people into the hospice.
Yeah.
Come in and have a look, come in and have a chat. And we do a lot of that. I know today my colleague, you're going to hear from Lorna later. She just showed a couple around the hospice this afternoon that were quite interested in what we might do. So yes, please come in. We run here at the Council Brecknock Hospice, we have a social cafe which runs 2 Wednesdays a month. Is it the first and third, I think, isn't it? Where we invite people that might have been bereaved, but actually anybody that might want to come and see how we are, where we are, what we do, what support we can offer them. So we do a social cafe, and that's on 2 days a week. We also work quite closely with our schools, because it's not just about people coming to us when they're ill, or sometimes when they're more mature in years. It's about getting those youngsters and those children, getting them energised and motivated, and to encourage them to go home and talk to their families about hospices. So we work quite closely with a few schools, and we do things like school assemblies and projects. And we've got a lovely senior school just down the road from us, which is our local senior school, who actually come and support our daycare centre quite a lot. And you know, our patients that come and enjoy that just absolutely love interacting with teenagers.
Yeah.
Particularly if they're not your own, which is always very good.
Marvellous.
Yeah. We also are running now as you know, we opened in 2020, which was during COVID, and we have we ran a few initial open days before we opened, but now we've got a whole host of open days. So if anybody would be interested, please go and have a look on our website, and all the details are there. So we're opening the open days for members of the public who might want to come in and have a look around, because people are often quite curious, even people that have donated money. Where's my money gone? What have you spent it on? Who are you looking after? Or actually, I know my neighbour came in. Can I come and see what the hospice is like? We're also exploring our open days and opening them up to our healthcare professionals as well. So we're having a local GPs open brunch lunch. So I know, give doctors some food and they'll come along. So they're coming along for some brunch and have a look around the hospice, see what facilities we have, because they will be our advocates and they're the people that will be talking to our patients.
Right.
We're working with any number of healthcare professionals, social groups, and if anybody would like to come and have a look, then we will only be too delighted to invite you, and we'll come and talk as well.
Brilliant. Well, we've already visited we've been to the hospice here in Basingstoke, we've been to Winchester. We're actually going to dedicate our next meeting next month to dispelling the myths. So we will be in touch. We're already in discussions with a couple of the other people, so I'll be in touch. Thank you.
We'd be delighted to see you here. I'd love to show you around.
Thank you.
Thanks, Eileen. Simon.
Thanks, Lara. Just making sure I've come off mute, and hopefully you can hear me.
Yes.
Good. Okay.
Introduce yourself, because you're a very important person.
No, not really. I'm a trustee at the Winchester Hospice, but that's very kind of you to say so, Lara. An observation and a question, really. So the observation, firstly, I'm really interested in that conversation around the quality of the experience that we offer in the hospice over the experience of the hospital. I'm really keen to, Lara, you will know, I'm very interested in the outdoors, the transformative powers of nature, being outside, and pets, and all three hospitals have talked about that, which was a huge delight for me to hear that. And I'm absolutely committed to that kind of idea of how do we extend that experience, how do we make that experience available to more who come into contact with our our well-being and our hospital estates. So that's the kind of observation. So it's a broader conversation, isn't it? Right? How do we meet that challenge, and in terms of the whole environment? The question was really about that kind of raising awareness of what a hospice is, what it means to the community, its place in the community. And I'm just kind of wondering, I'm sitting here kind of wondering about the role of social prescribing and green social prescribing in hospice. Well, there's something we might do more, if we're not already, in those terms, to increase that kind of engagement at all levels and opportunity for people to come in and contribute in some way to that well-being, that care that's going on. I don't know the answer to that, but I'll kind of throw it out there.
Yeah, no, a brilliant idea. And I think, when we think about the amount of time some people end up needing to be in hospital, and the struggle with not having any access to outdoors, definitely. But also just the challenges of people with limited mobility, getting out at home and things. So I completely agree. Let me bring Liz in. Hi.
Hi, thank you very much, Lara. It's not a very good segue from Simon, I'm afraid. No, I completely agree with what you just said in terms of social prescribing, Simon. It was really just to pick up and thank, everybody that's spoken about. What came through loudly for me was using imagination and really expanding care, because Maddie talking about education, and turning beds around and all those things is about using our imagination, I'm sure, and it's a very powerful tool that we all have. But if I may just very briefly pick up, Donna very kindly mentioned the biography work that I'm involved in, and it's now called Stories for Life. It's a charity which offers to people who are towards the end of their life, and it could be at home or in the hospice or in a care home, opportunity to audio record anything from their life. So it could be a sort of chronological talking about their life. It could be a few stories and a few nuggets for their families. So it's something that they can leave as a legacy. It may be something they'd like to leave a message for their grandchildren, or something specific that they'd like to say. And the few that I've done so far have been a real honour for me to do. I'm a nurse by background, worked in the hospice for many years. But actually it's just been a joy to meet the families and to recognise the importance of having the voice as held by the family and sent to them and kept. Anyway, I just thought I'd take the opportunity. Thank you, Lara.
Brilliant. Thank you, Liz. I'm going to invite Gemma just to respond to any of those points. I'm trying to be equitable with our collaboration.
Well, I think, I mean, I don't know where to start really. First of all, I think the imagination and what you were saying then, that is one of the absolute privileges of working in hospice and end-of-life care, because we slightly ignore the rules that you have to obey by in most other areas, and you get to think outside the box. And I was just smiling through all of Sarah's stories, because we've had weddings and animals, and Ruby wedding anniversary we had a couple of weekends ago, and you know, the stories are endless. And I, again, this is from a personal point of view, but people when they ask me that, I tell them I'm a doctor, and then they say, well, where do you work? And I say, work in a hospice. And often they go, oh, do you enjoy your job? Did you choose to do that? And I can't tell you the amount of joy I get from my job through doing all of those things that you mentioned. And then in terms of talking about how do you reach out, I think we're very lucky, and this is where the collaborative stuff that we do works really well, because all of the things that Sarah mentioned that they're doing in Andover, we do in Basingstoke, because we talk and we think, if that's a good idea, well, let's give it a go in our area too. So, you know, we do the schools and the other and all those things. The thing we're really learning about is the power of social media, and that is where people are going to these days for knowledge and advice, and again, particularly in the younger cohort, and even down to our recruitment. And some of our successful recruitment has been through the power of social media, and that is where working in a hospice is not just about being a clinical person. It's from any part of the hospice, because it's the people who are working in those departments that actually can have more of an impact than I can do day to day. So very much a team approach all the way through.
Brilliant. Thank you, Gemma. And please do tweet about the caring conversation this evening. And feel free to like my tweets as well. So if there are no other burning comments or questions, I think we'll move on. So we've got some of the people who work in hospice care now to talk about what they do and give you a bit of an insight into that. So the first person I'd like to introduce is Megan from Winchester Hospice, who's a preceptorship nurse. Welcome, Megan.
Hello, so I'll just introduce myself. I'm Megan, and I am a newly qualified nurse. I've been qualified for just over a year now, and I did my training at the University of Surrey, and I've worked in Winchester Hospice since it opened. So I was one of the lucky ones to work with everyone else. And actually, interestingly, within my final placement as a student, I did my placement in St Michael's Hospice. And that's what made me realise my love for palliative care, because the team there was so friendly, and it was my first ever experience in a hospice. And I sort of had a light bulb moment thinking, oh, so this is what nursing care is supposed to be like. This is good quality nursing care. And I think that's reflected in everything we've said today and all the work that goes on in a hospice. It's the bread and butter, I like to call, of nursing care. It's back to the basics. It's being able to have time with the relatives, which is one of the favourite bits of my job, because sometimes we find that when our patients are very calm and settled and at peace, it's the relatives that actually require more support from us. And I think we're so privileged just to be able to get a little slice into their life, that they allow us into their lives when they're at their most vulnerable and they're going through so much inner turmoil, for us to be able to make an impact and even just make them breathe easier, if that makes sense. Make them breathe easier in a day is such an important thing. The overwhelming thing that I've found since working at Winchester is the strong connection that we have as a team, not just within our hospice, but also within the whole palliative care service as a whole. So with the other hospices, with the palliative care team within the hospital, within the community team, within the volunteers, and even within things such as like choirs raising money for events and Christmas events and Halloween events. And for me, being a newly qualified nurse, that was so important, because obviously I had all the normal anxieties that I have being a newly qualified nurse. But everyone was so supportive, and we get on so well with all of our HCAs and our doctors as well. It's a real MDD approach, and everyone is there for the patient and the family. And I think that's the feeling that you get as soon as you walk through the door. And it was interesting. I think some people were asking questions about how to sort of break the myths of hospice, and we see that on a daily basis. Family and relatives walk in and they're so anxious, and I think that's a big part of hospice care, how to sort of relieve that anxiety and make them realise, oh, okay, this isn't as bad as I thought. This is a home away from home, and for me, that is just so satisfying. When they say, oh, I've really relaxed, and you can see the family relax, and then they start to open up to us, and it's just such a privilege to work here. And I don't want to ramble on too much, but within my own personal life, since working at the hospice, I have started to look more into counselling courses, and I've actually completed a level 3 diploma in counselling, because I think the more like the social prescribing and the psychological support side of it is so important. And that's why I think it's incredible that we have our chaplaincy service and our psychologist Eliza, and the opportunities for staff and also families to learn new things about their own loved ones. And palliative care, I think, is so needed in the wider community as well, because at the end of the day, we're all going to need palliative care service. And I just feel really proud to work in palliative care. When you tell people what you do, they say, "Oh, that's amazing. How can you do that?" And it's like what you said, Gemma. They say, "Oh, what made you want to work in? Are you sure you've chosen the right place?" And I think, but it's such a privilege and an honour that people allow us into their lives. And yeah, I just feel very lucky to be working in Winchester Hospice. Sorry for rambling.
Oh, brilliant, Megan. Thank you very much. And thank you for everything you do. And the fact that you do take that message out wider than just in the hospice. So important. I think I see the matron of the future. So watch out, Donna.
I'm watching. Absolutely. My goodness me, I couldn't be more proud now to see Megan on her journey. And we sat and we reflected together. Sorry, I've gone off screen. And I'm unsure if palliative would have been the right thing for me at the start of my career, and probably had those myths myself. But the privilege of working alongside Megan as a newly qualified nurse, my goodness me, listen to her. How lucky are we to have people that, and we're so passionate about the care. But not only in palliative, Megan's been able to develop some fantastic knowledge and skills in her growth, which I think was good foundation to take anywhere. But equally fantastic for us. And yes, I am watching my back. I better get out quick, but huge well done, Megan, and thank you for sharing your story.
Thank you for letting me share my story. It meant a lot.
Thank you, Megan. So as last time, we're going up the M3, and delighted to introduce Rahul, who is charge nurse for the inpatient unit at St Michael's. Over to you, Rahul.
Good evening, everybody. It's lovely to be here and to be in your company. It's fabulous to hear all the stories we've heard today. Megan, congratulations. We're so proud that you're part of the nursing team. You've got a wonderful mentor sitting next to you. I can speak from personal experience. Donna, it's her fault that I'm a nurse. She encouraged me, she taught me, and we had a lot of laughs along the way. And what she did was make nursing fun. And I think that's one thing you have to remember. Although it's hard, although we do difficult tasks every day, it is fun what we do. And it's fun because we enjoy it. So huge congratulations to you on becoming newly qualified. And thank you, Donna, for everything you did for me, and Alex Whitfield, who was absolutely phenomenal in helping me again to achieve where I am. We've heard a lot of amazing stories, and I think when Eileen earlier spoke about how do we break the myth of dying and hospice, I think you only have to listen to what's been said. It is there in our own words, the collectiveness that we have, the passion, the dedication, the drive to help those who are in need is enough to smash any myth and any obstacle and barrier that may stand in our way. We are unique. Nursing and care, whatever our clinical status or non-clinical status may be, is a unique place to be, to hold hands with a patient who is frightened, who's scared, vulnerable, even contemplating suicide, because their disease is now beginning to take over. What we do is we give them some hope. Their prognosis will not be good. We can't change that. We don't have a magic wand, but one thing we can do is give them the opportunity to live. And I think with all of us, with all our multidisciplinary team approach, with all the wonderful people who work here, either clinical or non-clinical, our volunteers, even to our wonderful housekeepers, we make a patient allow themselves to have some form of life. The disease they have a disease, but what we try and do is to ensure that the disease doesn't have them, that they do have a life, that we are trying to get them home. We will look after things like symptom control and pain management. And as Gemma quite rightly mentioned, our hospice at home team, a dynamic nursing team on wheels, they will go out at any time and they will sit with patients, and we will reorchestrate, redesign their care package if we need it to keep them at home. But also one of the most important things that we all do as nurses, wherever our specialities may be, is that we bring humanity. We face humanity to meet people who we've never met before at their lowest ebb, and just to hold their hands and say, let us help you, is a true definition of what nursing is all about. And it's one of the very few professions I can think of that allows us to meet people straight off and say, right, trust us as we trust you. We will look after you, your family. We will listen to everything you've got to say, and we will do whatever we possibly can for you, and a little bit more. And I think working in a hospice environment, it's fantastic. We look after each other as our colleagues. Yes, we see distraught things. Yes, we see people getting married, and it's also, as any marriage is, also a very happy occasion, but there are tears. But we try and replace tears of fear with tears of joy. And we also have laughter in our corridors, mainly at my expense, which I'm not quite worked out how it happens, but it does. And, you know, we have all sorts of things going on. And our communities have got this wonderful resource called a hospice. And yes, it's for us to help our communities understand and break these myths. But as I've said today, it's a privilege to be here. It's a privilege to be part of a nursing profession, and it's a privilege to work in a hospice. We do have some fantastic people amongst our ranks who are willing to give up their time and even give their experiences of what they have done in their lives to help others. And I think if you can be embedded in a profession or in an organization where we can do that and help so many people who may have never thought of the opportunities or even the care and attention that a hospice can provide. It's very unique and it's a very special place. I'm personally extremely proud to work alongside many, many people, not only the people here, but to have people across the road at Hampshire Hospital and even other hospices. To call you colleagues, to have you as colleagues is really inspiring. It's really wonderful. And I hope that people who have worked within the care profession and who have just qualified, like Megan, can take up, and I'm sure Megan will, the process that we all speak with so much passion with and make a difference, because that's what we do. We make a difference, not just for today, but we make a difference to everybody. And finally, as we all know, as Dame Cicely Saunders said, you know, it's how people die that is truly remembered. And I think one thing we all achieve when patients do unfortunately pass away is that we make it memorable and we make it special. Death is not to be frightened of, it's natural. And what we have achieved with so many families with our bereavement care when they come back, and it's not because of the tea and coffee alone, but they come back because they can't say thank you enough to us. And I'm so proud. I'm proud of all your achievements, whatever you have achieved and whatever you're going to continue to achieve, because without the support that we've had, we cannot fulfill our patients' wishes. So from our trustees to the volunteers to everybody associated in one way or another, from me, before the crook comes along and hoiks me off the screen, thank you very, very much. I'm so proud of all of you. Thank you.
Oh, thank you, Rahul. Really, really good to remind us that actually it's an honour to do the jobs we do. And thank you.
My
And
pleasure.
you can hear the pride in everybody of what we do. So thank you.
My pleasure. Thank you.
And then I want to just hand over to Lorna from Countess of Brecknock.
Hi everyone. My name is Lorna Cousins. I'm one of the palliative care community team at the Countess of Brecknock in Andover. We are a team of 3 of us, and I've been here for about 2 years. My background was many years in acute respiratory in Winchester, and part of the thing that I loved mostly about that role, I think there's some photos coming, and I'm sorry, Don, but I think there is one of you on there, Donna. Not to make it more about you, bless you. There is a photo of me newly qualified on the left there, very young, and with Donna there in the height of COVID, and Michelle and myself there, who were the nurses on the community palliative care team. Yes, so my background was respiratory, and I'd always been drawn to caring for patients at the end of their life, but was frustrated in many ways that I didn't have the time to give to the families and the patients that I felt I wanted to be able to give them more time. I looked into palliative care, and I started doing some shifts over here at Countess Brecknock, mostly night shifts, just working out how it worked. And I'm talking to the team here about opportunities. If I'm honest, I hadn't thought about community. It hadn't been on my radar, but actually I looked into it a bit more and applied, and I started here in May 2020, so middle of the height of COVID. And I love it. It's a brilliant team. We work as part of one big team within COB, as Sarah and others have said. We have 160 patients on our books, which has doubled since I've joined the team. We're not quite sure why that's happened, maybe more awareness of palliative care, but it has grown and grown. And we work, 160 on the COB books, and 10 are in the inpatient beds at one time, but we very much work as one team. In that we've had quite a run of younger patients as well, and I really want them and their children to get to know the team within the hospice as well, to make it easier going down the road. So I will bring them in, I will show them around the hospice, I'll do crafts with them and daycare, and actually just make it an easier place for them to be. Patients are referred to us at many different points of their journey. Some of them, it's symptom control, and we do have them on, as others have said, for years at times. We might pull back if things stabilise and then get more involved as we're needed. Patients are often very fearful of the word palliative when they hear it, and when I make the first phone call, I say, were you expecting us? Mostly they were, but they're still scared of that word. And, I say, look, we're a local support, let's meet and just chat about how we can support you. And then going forward from there, they're really appreciative of the time that we can offer them and that we can listen and spend time with them. And often it's the psychological support as well. Obviously, it is also part of people's end of life and their dying, and talking to them about what's really important at that point with their family, where they want to die, whether they want it to be at home or in the hospice, and helping them to make that happen. I love the variety. I literally never know what's going to happen every day. I love the privilege of being in people's homes, and actually the slight nosiness of my character works well at being in the variety of people's homes, and there is a complete variety. I've recently looked after, that's in our newsletter that's just gone out, a lovely retired vicar, and spending time with the family, talking about where he wanted to die. And he had a really lovely death at home with his family all around him that had come from around the world. And the GP actually took quite a few of the students out to show them what a good death could look like, because he had a lovely death at the end, and it was, the family just felt that the support that we're able to offer through various different linking with us went really well. And part of the funny bit at the end of that, because there quite often is a funny bit amongst end of life as well, was trying to find a bit of card to cut into the shape of a dog collar after he died, because we couldn't find one of the right ones. So me and his wife were cutting a bit of card to the shape of a dog collar. But it's just lovely. It's obviously very sad at times, and many families go, how do you do this? But actually it's the privilege of trying to make it a little bit better in those sad times. And being part of the team here, it's really good to be able to do that. So that's me, very brief.
Thank you, Lorna. Brilliant. So you've met many of our team, and the last person I want to introduce is Ian Cameron, the Chief Executive of St Michael's. So I will hand over to him for some last words, but I just want to add my pride because I won't get another word, my pride of everyone you've heard from. I'm so proud of everything that we've managed to do in this locality. So thank you everyone for everything you do, and it's great to be with you in the team. So over to Ian, thank you.
That's lovely, Lara. Thank you so much. And I'd say hopefully everyone can hear me, because the relief that we managed to get through a whole evening without anyone being left on mute. So well done, everyone, for that achievement. And thank you, Lara. I think going for how you started this, since 2005, and building, your part in building credible hospice services in Basingstoke, and being a real driving force behind the collaboration that we have in North and Mid Hampshire. It's absolutely fantastic. And for everyone who is involved in or has an experience of hospice care, they know the importance, and that's really come through tonight when Donna said, palliative care is everyone's business, and I couldn't agree more with that statement. It's about individuals, it's people, not numbers and statistics. It's the belief in a holistic approach to caring for all a person's needs, rather than just their symptoms or their condition. It's an approach that involves the needs of families and loved ones, exceeding the limits of expectations, with a single focus of keeping the person at the centre. And that's why we're all involved in hospice care. And that's certainly the privilege that I certainly feel in this field. And as Sarah described, from Countess of Brecknock, the designing the care around the patients, and that story of John and Violet there, and the ability to to make those real differences. I like being a maverick and working with other mavericks when the sole aim is to make a difference to maybe to one person, but thankfully in hospice care we make it to an awful lot of people. The pride, I think there's no other word, is there? The pride from our three nurses, Megan, Rahul, and Lorna there, talking about what it means to them, working in hospice care, and words like privilege, and nice to hear that nurses are getting back to doing nursing. That's fabulous things to hear. And as Rahul said, tears of joy turning to tears of fear turning to tears of joy, and that's something that really is important, and that's really shone through tonight. But as we we're for St Michael's being an independent organization, and then coming and working in collaboration with Hampshire Hospitals and the other two hospices, has been a significant step change in the past couple of years. And this is about collaboration that's without badges. Patients don't see the badges, so why do we see them? We're now working together as a whole system, and this presents a unique opportunity to stand up and take the lead and push things forward to improve services for local patients. And we've only done that by coming together, sharing ideas and sharing resources, and without the worry of boundaries or territories. It's a true example of keeping the patient at the center. Hospice care presents an opportunity to getting healthcare right. It's a last chance to get healthcare right, and one that comes with great responsibility that's never overlooked or forgotten. And thankfully, as we've heard tonight, our hospices here are blessed with the most wonderful individuals making up formidable teams focused on making a difference to those in need with their dedication and professionalism. I just reminded me, I think I've got a slide to share as well, so let's do that. Never liked this bit, so yeah, look, it's a reality. Yeah, it's a reality that high quality end of life care in the UK is heavily reliant on fundraising. It's so often the limiting factor in what service are provided and how much reach a hospice has. It really shouldn't be like that, but it is. And that's the brutal fact of the matter. Whether it's a cake sale, a marathon, fun run, secondhand books in a charity shop, or donations made in memory of a loved one, it all adds up to ensuring that hospices have the ability to care and have the time to spend with those where time is so precious. The support of local communities are essential. They galvanise and underpin the success of providing the care. And there are so many ways to get involved. Here's my pitch. So please do get involved using the contact details on those on the screen there, visiting the website, or making contact with the socials, and let's say get in contact with these amazing organizations. I'm not going to talk anymore. I just want to say, thank you all of you who've attended this tonight, and for those of you that have contributed, for those of you that have shared your stories and the news, and for those that have organized this event as well. Great hospice care doesn't just happen by accident. It only happens by working together. So thank you all once again, and I think we're done. So enjoy the rest of your evening.
Thank you, everyone. Thank you, Ian, and thank you for joining us. Please spread the word if you've learned anything new this evening.